Welcome back to TV5 News at 9. It is time now for Aging and Style with McLaren. Thank you so much for joining us. Today we have Dr. Chakravarthi. Thank you, doctor, for being with us this morning. We appreciate you calling in.
Thank you.
Of course. Okay, so today we are talking about neurosurgery at McLaren Bay Region. Now, doctor, are there any risks that make someone more susceptible to having a brain aneurysm?
There are a lot of things we don't know, but what we know is something like smoking, genetic background, and hypertension, drugs, infections. There are predisposing factors for aneurysms.
Now, doctor, what methods do you use to surgically repair an aneurysm?
There are two ways of dealing with the aneurysms, which have been fluctuating back and forth. At this time, I think 50-50 is aneurysm by surgery, that is craniotomy, another is coiling. There are specific indications and need to be evaluated, which is the best option for the patient in that given situation and given medical condition.
Now, doctor, what are the symptoms that people really need to look out for about aneurysms?
Majority of the aneurysms, they are indolent and they do not present to us, but when they present, usually it is a severe blasting headache, a type of headache they never had before. This has to be evaluated and analyzed from the common migraines that happen. So any headache that is not out of blue and does not happen all the time, severe headache, it should be always considered an aneurysm, unless proven otherwise.
Right. Oh, that's great to know. We need to all be aware of that. Now, doctor, what is another common reason for neurosurgery?
There are multiple other things. Neurosurgeon does a lot of brain aneurysms, tumors, infections, spine surgery, spinal tumors, peripheral nerves.
And doctor, when someone has a brain tumor, how do you determine if that brain tumor is operable?
Mostly we need to evaluate clinical situation, how the patient is at the time of presentation, and then doing other investigations like CT scan, MRI scan, angiogram. These are things that we do to see if these tumors are away from vital structures or are they closer to the vital structures, and determine if it is operable, inoperable, partially resectable. Situations change.
Yeah. Now, doctor, if someone notices, hey, this is just not right, this is a little bit worrisome, what are the first steps that they should take?
Yeah, it is worrisome. It is not a minor thing, but at the same token, a lot of benign tumors can be quite safely removed. In certain age groups, you need to be very careful. At the elderly, even partial resection will give them good longevity. The ultimate thing is avoiding morbidity. Once you keep the patient in the same condition, the outcomes are better.
Oh, that sounds great. That's what we want to hear. Thank you for this valuable information, and thank you so much for joining us this morning, doctor.
Thank you very much.
Of course, you're welcome. If you would like more information, head on over to the Aging and Style page. That's on WNEM.com.